alert level 3 to 1, allow progressively greater relaxation of restrictions. As I indicated then, some areas of the country may be designated at a particular alert level, while others may be designated at another level. This would be done according to the rate of infection in an area and the state of readiness and the capacity of its health facilities to cope with treating infected people. For now, infections are mostly concentrated in a few metropolitan municipalities and districts in our country. It is important that we maintain stringent restrictions in those areas and restrict travel out of these areas to other parts of the country with lower rates of infection. We will immediately begin a process of consultation with relevant stakeholders on the proposal that by the end of May, most of the country should be placed on alert level 3, but that those parts of the country with the highest rates of infection remain on level 4. We will make further announcements in this regard after the completion of the consultations we will have. In the coming days, we will also be announcing certain changes to level 4 regulations to expand permitted business activities in a number of sectors in the retail, in the e-commerce, and reduce restrictions also on exercise. Some of our people have questioned whether our approach in dealing with the coronavirus has been at the expense of the livelihood of our people. Our strategic approach has been based on saving lives and preserving livelihoods. Our key objective has always been to slow down the infection rate through a number of interventions in our coronavirus prevention toolbox. And each of these prevention measures are crucial and are non-negotiable. They being, 1, a lockdown which is meant to achieve extreme social distancing, which we have been on. Second one is social distancing itself. The third, adopting hand hygiene practices by washing hands regularly with water and soap or sanitizer. A professor told me that this has been the tried and tested method for over 150 years. Fourth one is the cough etiquette, including coughing into your elbow, like I showed the last time, or a tissue. The next one would be wearing cloth masks whenever you are in public spaces, like this, and wearing it properly. The next one is the use of personal protection equipment by all our health workers. The next one is frequent cleaning of the work environment and other public spaces. And may I add here, it should also include the cleaning of our living environment as well. Good hygiene. The next one is symptom screening. The next one is testing, isolation, quarantine, and contact tracing. It is in the implementation of all these preventative measures that we will overcome this disease. The success of our efforts to limit transmission of the virus depends on finding those who are infected as early as possible, tracing their contacts or those they've been in contact with, and isolating them so they cannot pass on the virus to others. Our door-to-door screening campaign in vulnerable communities across the country has resulted in over 100,000 people being referred for testing. This gave us a good indication of the extent of the infection amongst our people, but